The prevalence of HIV in the Middle East and North Africa region is 0.1%, the lowest in the world. And new infections have slightly decreased in 2016. According to available estimates, those who are living with the virus are 230,000 by the end of 2016. Stigma and discrimination, restrictive legal and policy environment, and disruption of services in communities affected by humanitarian emergencies all are contributing to increased vulnerabilities, especially among key populations. Preventing new HIV infection among key populations who are sex workers and their clients, men who have sex with men, and people who inject drugs, and the intimate partners of these populations can decrease the number of new infections by 95% in the region. The UN Joint Programme on HIV/AIDS, Unaids, has launched a fast-track strategy by 2020 to end the AIDS by 2030. The MENA fast-track targets by 2020 are preventing new adult HIV infections to have less than 6,200. Having 90% of people living with HIV knowing their status, and putting at least 90% of them on ART, resulting in 210,000 adults and 8,000 children on ART, with 90% of them virally suppressed. Since the last 4 years, there has been significant progress in advancing political leadership and improving the policy environment and forging new partnerships, which have paved the way for fast-tracking the AIDS response. The political leadership of the Arab League and Unaids in 2014 has resulted in the development and endorsement of the Arab AIDS Strategy 2014-2020.
You know, we are in defining moment, and this moment is critical for us in the fight against HIV/AIDS.
In a historic step forward, in February 2016, the Council has adopted a resolution urging Arab countries to fast-track their AIDS response within the framework of the Arab AIDS Strategy to end AIDS by the year 2030. The leaders of all the Arab countries have endorsed the political declaration at the UN Assembly, the Declaration to End AIDS by 2030, as part of the Sustainable Development Goals. Moreover, for the first time, the League of Arab States has addressed the Assembly, committing to increased investment and regional solidarity, including innovative resource mobilization and sustainable financing mechanisms. Also, women leadership in MENA is prominent, as reflected in the Algiers call for action on advancing gender equality and HIV response, resulting from a high-level meeting of women leaders held jointly by the Arab League, Unaids, UN Women, and Algerian government in November 2014, a step that further promotes the role of women leaders in ending AIDS. The ratification of the Arab Convention on Preventing HIV and Protecting the Rights of People Living with HIV, adopted by the Arab Parliament in 2012, took a decisive turn when Djibouti became the first Arab country to ratify in October 2015. People living with HIV and civil society across the region have become catalytic in moving forward the response. The strong voice of women from the region is also heard through the MENA Rosa network, which carries the voice of women living with HIV, not only giving hope, but ensuring the right to good health with dignity. In an unprecedented step for civil society in MENA, the Regional Arab Network Against AIDS, RANA, signed a Memorandum of Agreement in December 2014 with the League of Arab States on the role of civil society in the implementation of the Arab AIDS Strategy. This represents the first partnership within the region between civil society and such a significant intergovernmental body. MENA is the richest region when it comes to youth. Therefore, turning their vulnerability to leadership in the response is key for ending AIDS. In 2015, the regional framework Joint Strategic Actions for Young People were endorsed, highlighting compilation of key strategic priorities responding to youth needs in the region. With all these accomplishments, a question remains. Will we be able to end AIDS by 2030? Will our region make it? Yes, we can. We have accumulated experience, political will, strategic partnerships, and civil society in the lead. Still, more regional financial resources are needed for front-loading investment. Many countries in MENA have taken gradual steps towards recognizing and adopting a human rights approach to HIV. They have included human rights in revised national AIDS strategy, and Morocco has developed national strategy on human rights and HIV. The recent landmark court ruling in Egypt, which prohibited HIV discrimination in the workplace, the violations against people living with HIV that have been documented in Tunisia through the Human Rights Observatory, Lebanon Policy Forum on not asking medical practitioners to report drug overuse to police, and the most recent regional law enforcement and HIV meeting held to review the role of police as partners in the HIV response are all worth noting. For enhancing advocacy and voicing the needs of the most vulnerable people, Unaids in MENA appointed Yusra, the famous Egyptian star, as the Regional Goodwill Ambassador in January 2016. Since then, Yusra has been working with Unaids on advocating and raising awareness for fighting stigma and discrimination. In MENA, almost 50% of people living with HIV know their status, and 24% are on treatment. Since 2013, the number of adults and children on ART in the region has risen from 25,000 to more than 54,000 by the end of 2016, a more than 100% increase. We see an unequal progress towards the 90-90-90 targets in the region. In Algeria, the ART coverage is 75%, in Lebanon 51%, and in Morocco 48%. In Kuwait and Qatar, the coverage is estimated to be around 80%. However, the coverage in Iran, Sudan, and Somalia has remained below 15%. Countries in the region are simplifying HIV testing practices, expanding community-based testing, and using innovative approaches such as mobile testing services, making testing possible in accessible locations and reaching rural as well as urban communities. In some countries such as Morocco, Algeria, Egypt, Iran, and Sudan, the number of people tested since 2013 has increased by several folds. In Algeria, as a result, testing coverage has increased to more than 75%. In Morocco, it increased to more than 60%. Lebanon has succeeded in making 75% of men who have sex with men aware of their HIV status. The testing coverage among sex workers has reached more than 70% in Lebanon, 90% in Iran and Morocco, and almost universal in Djibouti. The OPEC Fund for International Development has provided a catalytic grant to Unaids MENA to start and scale up innovative testing and treatment approaches, with a focus on young people, key populations, and pregnant women in Djibouti, Morocco, Somalia, Sudan, Tunisia, and Yemen. With scaling up testing comes the question of making treatment available. The 6 GCC countries, Bahrain, Kuwait, Oman, Qatar, Saudi Arabia, and the United Arab Emirates, and some middle-income countries, namely Algeria, Egypt, Iran, Iraq, Lebanon, Jordan, and Morocco, succeeded in providing free treatment through their national funds. Yet, many of MENA countries remain dependent on external funding. Here, the role of the Global Fund in partnership with Unaids and WHO needs to be acknowledged. Funds to address AIDS, malaria, and TB have been made available for many countries in need, especially those facing conflict and humanitarian concerns. The Middle East response has been developed to collectively address the challenges in countries carrying the burden of refugees, migrants, and internally displaced people. Yet, sustainability of external funding will remain a challenge. And that is why the Arab AIDS strategy has called not only for increasing domestic funding, but also for shared responsibility and regional solidarity. In prevention, we also see major strides made by countries with strong civil society. In Algeria and Lebanon, more than 80% of sex workers have reported condom use with their last client. Iran, Morocco, and Lebanon have established opioid substitution therapy in communities and prisons. More than 90% people who inject drugs have used safe injection equipment in Lebanon, Morocco, and Tunisia. Lebanon's National AIDS Program has acknowledged transgender people as a high-risk population. In Sudan, interventions focused on key populations showed that peer education efforts have been effective. In Somalia, work is in progress to build and strengthen capacity of CSOs and community organizations to deliver combination prevention services to young people, key populations, and displaced populations. In Yemen, despite civil and political instability, treatment sites continued to deliver services. As a result, adherence improved and the number of patients lost to follow-up decreased. Elimination of mother-to-child transmission of HIV is a particular challenge in HIV epidemics that are characterized by infection occurring mostly among members of key populations and their partners. However, this challenge has not prevented countries in the region from progressing towards elimination. Oman and the United Arab Emirates are close to eliminating mother-to-child transmission in the region. Kuwait and Qatar are also very close to elimination targets. Algeria, Djibouti, Iran, Morocco, Sudan, and Tunisia are moving in that direction. To reach an AIDS-free generation in MENA, we need to transform political leadership and strategic partnership with the League of Arab States into action with more regional funding. Innovation in data, testing, service delivery, and re-engineering current models. To sharpen focus on key populations and to engage more with parliamentarians in the legal and policy reform. To empower civil society by further enabling civil society partners, including religious leaders, community and grassroots organizations led by people living with HIV, women and young people, to be central to designing, implementing, and monitoring the response. MENA region can be the first region to end the AIDS epidemic if we all scale up our efforts and work together. As Unaids Executive Director once said, this region can be a hub of excellence and greater partnership for development. Its values of social justice and inclusive society can help significantly reduce inequality as a threat to global health security. If you close your eyes and see HIV with a human face, someone you know, someone you love, you will feel and see how this disease can destroy families, communities, and economies. We are at a crossroad. Take the fast track. End AIDS.